Person-centred care is about generating better outcomes for patients.
Person-centred care is dealing with a patient, not a disease.
It's about looking after them, their family and the community. We started in a very, very small practice, and it was quite a little tight family practice with 2 or 3 people.
It was my dad's practice, and I thought I'll just come and do a little bit of work here, and loved it. When my dad retired, my husband and I purchased the practice, and then found the whole doing general practice and the giving 110% of myself to my patients, as well as I had my own young family and running the business, all got a little bit too much. So I stopped practicing for a little while. Didn't really know what I was going to do.
We're really quite isolated and reinventing the wheel, I suppose. Having the Brisbane South PHN around to work on experience of other practices, to network and use their resources has been extremely useful.
The first thing I think about when I think of Brisbane South PHN is just the hands-on help that they give us for any aspect. We've just gone through the accreditation process again. I now take a step back because I knew that my staff here, with the help from the staff at Brisbane South PHN, had that all under control. They've just really been so helpful in making the practice the patient-centred practice that we want it to be.
The lectures and the seminars that get run through the Brisbane South PHN that our nurses can go and attend, having the knowledge around the conditions that some patients have and then about what's available in our community makes a big difference to them not only being able to provide care but also being able to provide the most appropriate care.
We were invited by the Brisbane South PHN to become involved in the person-centred care program. It's really proved to be a tremendous stimulus for us to actually look at ourselves and just see ways we can improve. I guess one of the things that the program has identified is access to the practice. It's often a bugbear with patients, you know, I can't get an appointment, everyone's busy, so we've got a very good support network of nursing staff, so our clinical staff can triage for us. That really assists us in knowing which cases are urgent, which cases may not need to be seen today, so we can prioritise what really needs to come through the doors today. We also reserve appointments each day so that we've actually got spare appointments for extras and urgent cases. It means that they have care and they have care when they need it. You know, we live in a slightly rural environment and a lot of our doctors don't actually live locally, so providing that access and that service after hours personally has been really quite challenging. The Brisbane South PHN really went into bat and they helped to secure the deputising service to actually cover our entire geographic region. So that's been an amazing boon for our patients particularly, yeah. I think the person-centred care model, it gives the staff I think a more of a basis to look at the patient as being the most important person here. If
a new patient was to come here or even a new staff member was to come here, I'd want them to walk out of here feeling that we are one big team that is all there to support them through every way of their healthcare journey.